So the government has stockpiled 5 million doses of bird flu vaccine just in case it spreads and we get another pandemic.
Are you frightened?
How much this has cost? We're trying to get to the bottom of that.
Birds. Some doctors have called it a complete waste of money. And let's talk now to the director of the Centre for Evidence-Based Medicine at Oxford University, Professor Carl Heneghan. Great to see you, Carl. Good morning. Is this just the government looking like they're trying to do something because people accuse them of not being prepared for the last pandemic?
Well, look, about a decade ago, we spent £500 million stockpiling antivirals for in 2005 when we said there was a big panic around bird flu. We're back again now with this issue on the agenda. And what's happening here is somehow we've bought 5 million doses for H5. We can't find how much it costs. We can't understand what modelling it's based on, where the risk management plan is. So somehow it's not clear who's signing off on these contracts. And over here, I thought money was tight for frontline care. And then there was a big issue in the inquiry about box thinking, going into the COVID pandemic, thinking about a single virus. We find ourselves right back where we started. Seemingly, as you say, how much money are we spending? Who's responsible for it? And how can we afford it when we're being told you can't even give pensioners a winter fuel allowance? So I reckon we're spending hundreds of millions here and it's going to waste again. And it's based around the sort of frenzy that's come out of the COVID pandemic.
Let's take you back to 2005. What happened to the £500 million worth of vaccines? What happened to those vaccines?
So this was the antivirals, if you remember, oseltamivir. We stockpiled it after so in 2005, modelling came out and said, look, we're going to have another catastrophe. And in doing so, then we had the swine flu pandemic. And on the back of that, we got into a frenzy and started stockpiling antivirals. So we spent about £500 million there on a plan that said antivirals, despite the fact they didn't prevent transmission, would somehow stop a bird flu pandemic in its track. What's happened in the decade is it disappeared and now it's resurfaced because of our heightened awareness post-COVID pandemic. Pandemics are back on the plan and we're in this sort of, panic mode where somehow now we've got to protect the public. But the box thinking says, look, we've just had a coronavirus pandemic. Why are we putting all our eggs, if you like, into one basket? But there's a particular issue here which is important, transparency. We don't know how much it costs. We don't know who's signing off on this and on what assumptions it's being made. And when you think about that, how can you have a democratic government if you've no idea who's spending all of our money on our behalf and we can't find out just the basic details?
Well, it'll be to keep you safe, Carl Heneghan. If you learnt nothing, everything the government does in the last 4 years, it's all about keeping us safe. It seems that that's the excuse you can use to get away with anything.
Yeah, look, hold on a minute. As we go into winter, it's not about keeping us safe. I think it's a distraction from the real problems. As we go into this winter again, what we're seeing is acute respiratory infections rising. You've heard all this media puns about the quademic as though it's a major surprise that respiratory agents occur. And yet we don't have the capacity in place and the plans in place to deal with a surge. Look, our supermarkets know what happens at Christmas and they plan for more activity, more people turning up. December and January are the times in the health service when you need increased capacity, but nothing's been done, nothing's been put in place to sort that out. And it's the same if another pandemic came. Where is the increased capacity to be able to say you do not need the NHS to protect the NHS and it's going to be overwhelmed? So I actually think it's not just about being safe. It's also a distraction that we are not prepared to fix the main problems.
Am I right in saying that we're actually having a pretty poor flu season at the moment, that some of the hospitals are full with normal respiratory virus flu?
No, it's only a year ago, Rishi Sunak was calling meetings for the recurring winter crisis. About 19 out of 20 years, we have surge in acute respiratory infections. So in December, the number of people admitted to hospital doubles from August. It's about 15,000 more people will end up in hospital with pneumonia, viral pneumonia. So it's highly predictable what happens at this time of year. Somehow, it seems to be a surprise to our people in charge of the NHS and in government, yet it is recurring. If you type in NHS recurring winter crisis, you can go right back even to the noughties and you'll see people back in the Blair era going, we've got a winter crisis. So it's predictable. Yeah, where are the plans to say we're going to manage this predictable rise with about 20% increase in capacity to make sure we can look after those that are the most vulnerable?
Yeah, and yet weirdly, flu disappeared, did it not? 2020, 2021, we had no flu.
But also, can I just ask you about bird flu? How terrible would it be for the country if there was an outbreak of bird flu?
Well, look, in 21 years, going back to 2003, there's been 948 cases confirmed in the world. So, first off, there's no evidence of human-to-human transition. Most of the people that have got bird flu have birds and chickens living under their beds in the Far East. And so they've had infectious outbreaks and they live with chickens almost in their house or their backyard. So that's what we know. That is where the area and the issues are a problem. However, if it's going to transmit, it's going to have significant changes in its structure, which is what flu's doing all the time, influenza's doing all the time. But just remember, nothing really disappears. What happens is it's our ability to detect it changes over time. So there are actually about 30 different pathogens that cause pneumonia in the community in winter. You just get to hear about 3 or 4 of them, but there are many others out there that actually, some of them like rhinovirus, just give you the common cold. And in children, give them dragon and the coryza and the snotty nose, and it's a bit of a nuisance. So the advice should still be the same. If you're unwell, look after yourself, take care. But actually, the key is if you get complications, that's where you need to contact the health service, and we need to be available and ready.
And probably not lie awake worrying about bird flu.
Well, I certainly
And I think you raised some really interesting points, Carl, though, about the transparency. Who has written this off? Based on what modelling? What was their risk-benefit analysis?
And how much is it costing?
And how much is it costing?